everybody. So we have about a half an hour. So what I decided to do, I'm so happy Dr. Frame is here because I'm actually going to tap her into this since we just came back from a wonderful annual Congress of Integrative Medicine organized by a consortium of academic health centers. So I thought that we're going to just kind of chat about what's new in the whole health, sort of where things are, and you guys drop the questions in as usual. Believe it or not, I tried to look up some updates on COVID. There's not a whole lot. There is a pretty much worldwide phenomenon of a dropping of vaccination rates. A little perplexing why that is. There is some shame and blame going around. NPR just had a whole feature on measles, how there's a mistrust and people think that most of the decrease in all vaccinations across the board has something to do with just kind of a general anti-vaccine movement. Whether that's true or not, I don't know. We don't do politics here, but point being is, I think there's also some increase in a kind of a gradual fatigue of pandemic probably plays into it. On the positive side, there hasn't been more news on COVID. There's one new variant that's a subvariant of Omicron that's surfacing. It doesn't seem to be more concerning than the one before. In fact, I don't even want to give you the number because I don't think it's going to make any difference. But it's expected, right? It's expected there's going to be a continuous change in the viral strains, so nothing unexpected. Okay, should older people or those with health issues get the spring COVID booster? My answer is no. I'm very clear on that. I'm going to keep repeating myself. I don't think that we should be getting shots Q6 months. I don't believe that there's any particular reason for that. Despite the fact that that's what CDC says, I don't agree with CDC on this. I think that once a year for those vulnerable is sufficient. The only exception to this is if you have a very specific severe immune deficiency. And the way I define this is either your primary care doctor tells you that there is a strong reason to get more than once a year because for some reason your immune system is weaker, or you have advanced cancer undergoing chemotherapy, or you have an organ transplant and you're on immune suppressive drugs, or if you're on immune suppressive drugs for any other reason. There are other reasons why people could be on those medications. So in those cases, it's maybe worth considering twice a year shots. Everybody else, I don't believe so. I don't think there's an evidence to suggest benefit. So, but you keep putting questions in the chat. But Leigh and I is going to kind of talk about what's new out there in the whole world of integrated medicine. I think personally, highlights for me were profound amount of the two main things. So one big one was sort of this new information of some of the brain changes and brain studies, particularly in the area of some psychedelics and also some mind-body practices. There were some really fascinating presentations on that. That's kind of a takeaway for me is that we are pretty much learning rapidly understanding effects of mindfulness and psychedelics on the brain, not just from perspective, okay, this part of brain lights up, but now we're beginning to understand some of the much finer details, like why certain things happen in this way. So to me, somebody who's really interested in a kind of cognitive health and brain health, this was pretty fascinating talks. The other one was to some degree AI. I didn't hear a whole lot of news, but I think just the fact that there's so much and we expect such a massive changes for our entire practice of medicine. I think it's essential that we all discuss this and that we all anticipate changes. Now, you may not see this yet in your own personal life, but I will guarantee you that even if you're not ChatGPT user like Leigh and I, you will see changes in your life based on that quite substantially. So those are the two big things for me. I'm trying to remember, was there anything else really cool? There were a lot of
Yeah, I've got something on the AI. So I was at one of the talks where they were talking about AI being used for therapy as sort of a way to, we don't have enough therapists to service all the people who need therapy on a regular day, let alone on a day of high stress or during a pandemic and all of these things. And if we had an AI therapist who did a good enough job to kind of fit in between that could really extend our capabilities. And there's a program, I believe it's called Core. I was just trying to Google it. Um, and they have been studying it, and it does a really good job to the point that I was like kind of creeped out by it. You actually talk to it like a therapist. It's like, how are you doing? It's good to see you. And you tell it how you're feeling. And it's like, well, from your voice, I feel like maybe you're unsure of yourself or you're feeling unconfident about this. Why is that? And it really functions like a therapist. And that kind of blew my mind. And whether it's ready to go or not, I don't think it matters. The fact that we are that close is really what's exciting. So I think the ability to provide care in these novel ways is going to fill some of the gaps that we currently have. Like we just don't have enough people and we don't have enough training programs to produce the people. So having AI to help, and it's better than some of the like the chat therapy. I don't really love the chat therapy apps because you're not getting that, you don't hear the person's tone of voice. They can't hear your tone of voice. It's a little bit harder to actually have a meaningful connection, even though you are talking to a human being. I feel like you could almost get more of a more of a meaningful connection with the AI because it is hearing you and you are hearing it.
Yeah, great. What else was highlight for you?
Um, Another big highlight for me, and this might be, I'm putting on my CWO hat here, is there is a lot of talk about working with healthcare providers before they become healthcare providers and making sure they're taking care of their own well-being and so that they could be better providers, but also because then they can talk to their patients about taking care of their well-being and giving just the basic training, the things that I think you and I, Misha, probably take for granted as being key elements of health and wellness, and giving them the skills to be able to take care of themselves and to help their patients. So things like nutrition, physical activity, and yes, all the mind body stuff that we're doing, but giving it to them earlier instead of waiting until they're burned out and then trying to help them. So that was very exciting. I think it was a theme in a few different sessions.
I'll shamelessly say that I think my talk was well perceived. I gave one of the
Very
plenaries,
much so.
and I thank Dr. Frame for recording it. So if you guys want to see this, thanks Elisa for posting the link. So I just reposted it if you came a little bit late. So check that out. It's not necessarily a comfortable presentation. I wasn't making it so. I think the idea was make it thought-provoking and in a way upsetting to show that the care for older adults in this country is really poor. So to take it for what it's worth, obviously the talk was aimed at healthcare providers and administrators and people who were attending conference, not for general public, but still. So
I think it's something that people can identify with, though, right? We've all been to a healthcare provider that we felt like wasn't really listening to us or was so focused on one particular aspect and not seeing all the other things that we were there to talk to them about that they kind of felt like they weren't getting at what we're actually asking them to do.
yeah, yeah, yeah. And then Ashley, our new medical director of CIM, gave a wonderful long COVID presentation that was a standing room only with more questions that we could handle. So that was really exciting to see. And I'm sort of excited to see that how much growing push within our consortium there is for long COVID, that I think a lot of institutions are realizing that these are the teams that should be taking this care of patients, because we know the skills and we actually, well, if you're following the news, you just saw, and I think was it a Washington Post article, they're basically saying we're still 5 years out, have no idea what we're doing with long COVID. And I kind of want to say we do know what we're doing. We had a lot of good success stories, and none of them are purely medical. So I think the fact that consortium is embracing, and I keep pushing Ashley along with other people to say consortium should form like a special interest group and really promote its activity and really champion this field, because I think we do have more answers than sort of standard of care. So I think to me that,
Yeah, very much. And everyone was really hungry for that. You could tell, like, what are you doing? Because it is so individualized, and you using case studies, I think, was really helpful. But
Mhm.
one of the things that was brought up, and I think is really important, is publishing on what you're doing so that others can not only benefit from that knowledge, but then they can cite it when they're talking to other people in the department. Look, here's a peer-reviewed article saying this is how long COVID should be treated, and I'm following that.
Exactly. Yeah. I want to keep going with sort of in and out of the questions. So I think there's really important question about what's going to happen with Medicare telemedicine services come April 1st. So that's a great question. Formally, the pandemic coverage for telemedicine expires on March 31st. I think that's what Randy is saying. There is an attempt at sort of extend it at the very specific rules. No one knows what it will look like. At the moment, it's going to be a last moment thing. At the moment, we don't have any additional guidance through medical faculty associates, so I am not changing my practice. So if you're my patient, you will see that I sometimes would suggest that you see me via telemedicine if it's convenient and appropriate. So, but Randy, thanks for bringing this up. I'm definitely keeping an eye on this, so don't hesitate to ask me next time. I think there's going to be something. Obviously, there's a big pressure on Medicare to extend it. And in fact, there's a pressure by several large organizations to extend it, in essence, forever. There's actually, believe it or not, there is something called American Telemedicine Association that's kind of a spearheading policymaking efforts to preserve telemedicine. So will they follow? We're in such a political shift that I would say we have no clue, and things are changing day by day. So I only can say stay tuned. So, okay, great question. Elise is asking an important question. I think we touched upon that last time, but let's talk about this again because it is important. So are older people still protected by childhood measles vaccine? The answer is at 90+% certain, yes. If there's any hint of why you would be worried about it, there's a very simple way you can check for it. You can order a measles titer. So you can actually check your blood work whether you still have effect or not. But more than 90% people who have had vaccine shouldn't worry. It's lifelong immunity. It does not decrease very significantly even when you're over 65. So should we check titers on everybody? I don't do that routinely just because the risk is so small. If there's a specific immune condition, though, like there are some patients I have who have immune weaknesses of various conditions, especially if the immune weakness is within the domain of antibodies response. So I have a number of patients with low IgA or IgG systemically, and those are the patients that sometimes I would monitor because those are the patients who would be at the higher risk for having low levels, and they may need to be vaccinated again. Yeah. All right, Salome has a hand. Let's do that, and then we'll see if we'll come back to.
No, it's about measles. I don't think I was vaccinated as a child, but I think I had measles.
So that would be equivalent. If you're worried, let's run your test. Let's just run the titer. Whenever we need to do the next blood test, if you want to stay for a couple of minutes after today, and I'll talk to you somewhere and I'll order the test.
Okay, thank you.
I don't know if you need other tests. That's what I want to take time because I want to take a look.
I don't know. I'm scheduled to see you on April 1st.
So if we need blood work, it would be good to run it before that.
Okay.
Yeah, so IgM, right. So low IgM could be a hint that there's something off with the immune system, and you may want to look into it. Randy, it's IgM is considered a recent memory, so it may not actually be relevant to measles because measles is always IgG. Well, not always. I mean, you would have IgM response in the first few months after the vaccine, but then it'll gradually dissipate over 6 to 12 months. But IgG response will stay. But if people have generally low IgM, you may want to be careful because sometimes deficiency in one group of antibodies is a signal that there's general dysregulation of immune system. You probably should want to talk to someone to make sure that's not the case and it's just an isolated, non-important problem. All right, did I miss anything there? Or we got it?
Sheila has her hand raised.
Oh, okay, Sheila, go ahead. Thank you.
Can you hear me?
Yep.
I just want to say, maybe you and Dr. Well, I guess not Dr. Frame, but she's like a Dr. Frame. She's like a Dr. Frame to me. So anyway, that you all could consider having a patient forum to talk to doctors, maybe once a quarter, a couple times a year, because we always hear from doctors. But I think if you were to hear some of the experience of patients,
I love it.
I love it.
That would be very insightful for the doctor group. So that's all. I just wanted to bring that suggestion up.
We definitely organize this, no question.
Yeah, I think the providers would find that very helpful too, because a lot of times they don't have time to hear from you. Like they would love to hear from you, but they only are given this 15 or 30-minute window to see you. So I think that would be great.
So you know what we can do, Sheila? I think what we should do is let's make not necessarily part of this meeting, because I don't think there's going to be enough time here. So we only have about 15, 20 minutes for wellness talk. I think we should do this as an open house for the CIM, and then whoever CIM practitioners who want to come, and maybe I can invite some of our other affiliated folks and anybody who wants to come and just hang out, and you can come ask any question. There will be kind of this open agenda. You can share anything you want with us. I will tell you one thing for everybody, since we're on this topic. I had a meeting with the leadership DC Blue Cross Blue Shield yesterday. Actually, Lisa was there and Amy Kossoff, our medical director. And it was pretty eye-opening how much currently there are huge problems at the level of emergency rooms in the whole city. And basically very long waits, very poor satisfactions. It doesn't even matter what insurance you have. The city seems to be completely overrun in terms of quality of care in emergency room. I also same day yesterday after that, I talked to one of our senior emergency medicine doctors as part of my leadership training, and he was basically saying it's a total zoo. It's not unusual for some patients to sit for 24 hours or longer in emergency rooms. The care is really poor. Not necessarily that there's a fault of a doctors or nurses, it's just there is a dramatic overload on the system. And when that happens, the capacity is not there to take care of everybody well. So there is a big struggle in a healthcare system, as an example here. And the problem is there is no real easy solution. So if you're listening to this, my strong recommendation, if you are in the area, if you need an urgent care of some sort, do not go to any DC hospitals.
Agreed.
Go to Holy Cross here where I am. If you're in Silver Spring, if you're in Virginia, go to Inova or Alexandria. They definitely have more, like there seem to be less run down, and they have more staffing per patient, and the care seems to be better. So some of these questions we can address like this. And so if you have a particular concern, bring it and we'll try to talk about it.
There's a question in the chat about nutrition, so I'm going to take that one.
That's for you.
Is a plant-based vegan diet okay for diabetes? It seems like a lot of carbs. So the answer is both yes and no. And it totally depends on the quality of the diet, right? So if you are what I call a junketarian, right? You're eating a lot of processed vegan foods, refined white carbohydrates, all of those things, it is terrible for you. But if you're eating almost exclusively whole plants, right? Like you're having broccoli and apples and beans and lentils and those sorts of things, or whole grain rice, or even white rice in small amounts. I'm honestly not concerned about it, because you're getting so much fiber, and what happens is the fiber it's going to make you very full. So you aren't going to eat as many of the carbohydrates as you might think. Like if you were having a processed carb, you can eat a lot of them, but a whole carb, you get full. The other thing is it also actually lowers the insulin response. It slows the way the carbohydrates are processed. It makes them kind of slowly leak out of the gut instead of having this like bolus of, ooh, here are all the carbs that hit you at once. And so it's almost like having fewer carbs because of that. Not exactly, but it's very similar. So I'm certainly not anti-plant-based vegan for diabetes, but that being said, it can be sort of difficult to implement. So I would really urge you to work with a registered dietitian or a certified nutrition specialist to make sure you're getting all your bases and you aren't deficient in B12 or one of the other nutrients that are of a concern with vegan.
Leigh, wasn't there a study by Neil Bernard's group? Weren't they looking at control trial and it was
Yes,
really good
they've
result?
they've shown incredibly good results. But I think the reason that their results are so good is because they are really good at selecting patients. Right? It's about finding the right diet that's going to work for the right person. And they're really good at finding people who are both interested, motivated, have the ability to do this diet. And so I'm more concerned about figuring out what is the right diet for you as opposed to fitting you to the right diet. But there's always going to be a right diet. There's going to be something that works really well for you. Your family will accept it. It's culturally appropriate for you. And that could be a plant-based vegan diet, or it could be what we call a flexitarian diet, where you're kind of sort of plant-based, but you also eat, maybe the occasional egg, the occasional fish, maybe even the occasional turkey. Like it's a little bit more of a relaxed version. And that tends to be what I recommend is more of a relaxed version of dieting. Mostly because it's not worth the stress, right? Like I don't want you stressing about your food and nutrition, and I really want you to enjoy it, love being alive. That's the most important thing to me. And so if you can focus more on getting lots of different plants, minimally processed and lots of different colors, everything else kind of takes care of itself.
So I'm guilty. I have a friends from Texas visiting, and so they make this honey glaze and bacon. I was like, oh my God, I couldn't stop. So
That
what
was phenomenal.
I was like, okay, I'm gonna have 3 strips here, which is like I may have bacon once a month at most. So I just had a whole bowl of salad. That was my breakfast.
There you go.
Offsetting anything concerning with more plans. I mean, I think there is an evidence to suggest that that works. It's not
Absolutely. I think a large part of the evidence showing that particularly processed meats are bad for us are in people who aren't or not on a high fiber diet. And when you are on a low fiber diet, what happens is those foods actually sit in your gut longer and then it's exposed to it longer. So that's why you have these higher rates of colon cancer in people who eat a lot of bacon. But maybe if you add enough fiber, it could start to counteract some of that. Is it going to completely eliminate it? Probably not. But if you're only doing it occasionally, then it's a really small risk anyway. So it's all about moderation and not totally dragging yourself through the ringer for things.
Yeah, we're not going to let our Texan friends back here for a while. It's okay.
There you go. You don't want to be doing that every day.
No. All right. Well, we're close to half an hour, so let's make sure there's no other questions. I don't know. I'm actually thinking that AI is going to be a good thing more than a bad thing. The more I interact with AI, the more I see that the default network there is the kind of a compassionate emotional response, which is based on evidence. I'm guessing that it's actually going to end up being better and more consistent compared to working with a human in some way. Of course, it will never replace the psychologist, psychiatrist, or social worker, but but the problem is we have, well, first of all, I mean, very few mental health practitioners accept insurances. By the way, when we talked to Blue Cross people, one of the people who were there is the head of the behavioral health for the entire DMV Blue Cross. And he was very clear, like the behavioral health is one of the top needs and also top projects that they're willing to cover. In fact, we had a very concrete conversation about how they can finance us. It wasn't like they listened to us and they're like, we like this idea. Now we need to figure out how to fund you and like what information you need to give us to fund you and how this needs to be structured. So they're very interested in any interventions that includes behavioral health. And the reason is there's just not enough providers and there's such a global need. And guess what? It's only going to get worse, right? I mean,
correct. It's not going in a positive direction, that's for sure.
No, and that is concerning. And I think that's also means that we're going to keep doing this meeting.
Yes, it does.
It's part of our.
We will be here.
We'll be here. It's part of our mental health. And I need this today, like probably more than I usual after this whole. I don't know, I got really frustrated with this whole billing situation, you know. I think we all humans, on the big scheme of thing, my problem is nothing, it's little potatoes.
I can't wait till we can give AI all the billing problems.
That's right. Well, Alyson, thank you so much for joining us. Wonderful. Do you want to introduce yourself a little bit more? I know Janet gave us a little intro, but
Sure. Thank you for having me. It was about a year ago I came and joined a meeting. I was just wrapping up my degree program at Maryland University of Integrative Health. And now here I am this spring and I'm complete. And I just launched a private practice in addition to the teaching that I do at Thrive Yoga in Rockville and American University in DC. I'm working on a private practice to draw clients in that want to work one-on-one on therapeutic yoga practices. And the business is called Pathfinder Wellness. I was drawn to that because I also really enjoy hiking and getting in nature for more like walking meditation and connecting to awe and nature. And thankfully, and yoga therapy is a collaborative process that you work with individuals to find personalized practices that help them find balance and well-being. And the practices could include yoga postures, breathing techniques, meditation and mindfulness practices, getting outside. So it's about finding the right fit for the individual. So it's definitely like finding a path, and then adding on the addition of walking meditation outdoors. That's sort of how I came to choose Pathfinder Wellness for my practice. I have been teaching for many years, and I'm really enjoying this new shift working with individuals that have either conditions that make them want to work with me more one-on-one, or maybe they feel overwhelmed at the idea of being in a public space. They really want some personalized attention. So you were talking about mental health cases and how there's such a need for that in the world right now. And if there's not an acute problem, yoga therapy can be a really nice complement to get people feeling what's going on in their bodies and talking through the sensations and what stress, for example, might feel like and where it's located and how we can apply different practices to help bring balance. So that's a little bit about me. I thought for today I would bring you a yoga nidra practice, which is like a guided meditation. Yoga nidra means yogic sleep, and it's about being deeply restful with awareness. So not, when you actually sleep, there's a decreased level of awareness. So this is called like the hypnagogic state, where you're in this kind of in between, and the focus of the practice is on relieving stress. Before we get started, though, a big part of the practice is called setting an intention, or a sankalpa in yogic terms. And I wanted to discuss that just for a moment, because we're often asked even or encouraged to set an intention or a goal in either a yoga class, or maybe it's the beginning of the year and you're thinking about things you'd like to tackle in the year. But from that perspective, we're often setting goals or intentions around things that aren't yet, we perceive them to be something missing from our lives, something that's lacking. And so from the yogic perspective, we want to flip that with sankalpa and really celebrate and give and amplify the voice to what actually is. So for sankalpa, you make a short, positive, present tense statement. And instead of saying like, I want to get better at warrior two posture, maybe your intention or your sankalpa is, I am strong and present in warrior two, for example. Or if you're feeling overwhelmed for whatever reason, your sankalpa could be, I am at peace today, or I am present today. So you really celebrate and kind of channel it, what you want to call forth. So either if you would take a moment and just come up with an idea, a short present tense statement, I am statement that comes to mind, whatever the first thing that is that comes to mind. You're welcome to write it down if you have a pen and pencil, or type it if you're at the computer, or even just reflect on it for a moment. What might that be? What makes sense for you today to really solidify that idea of sankalpa or intention? And once you have that, feel free to take another moment if you're still settling on one. Come into a seat that's comfortable. You're welcome to lie down if you are near a yoga mat or a couch. You're welcome to sit back in a chair if that's more accessible for you right now in this moment. But if you are seated in a chair, try to make sure that your feet touch the ground, or you can pull a stool over or a pillow, put it under the feet. You want to be able to sit back and relax and feel supported either in the chair that you're sitting in or the ground that you might be laying on. And as you get settled in to that seat or the reclined posture, if you're comfortable, let the eyes softly close. And we'll take a couple of deep breaths in and out through the nose. Noticing where you feel the breath mostly as we get started. And then noticing if you can recruit the belly for a little bit of a deeper breath. Stretching out the exhalation helps to soothe the nervous system. Deep breath in, long breath out. Now that you're comfortable in your seat or lying back, we'll begin the practice of Yoga Nidra. I really encourage you to support yourself with blankets, pillows, anything else that would help you feel comfortable, warm, and supported for the duration of the Yoga Nidra practice. As we're going through the meditation, please do your best to stay alert, yet relaxed. If you feel yourself getting sleepy or notice your mind wandering, return to the sound of my voice. Please state your sankalpa silently to yourself 3 times. We will now begin moving your awareness to different parts of your body. Follow my voice and quickly bring your attention to the body part I name. As you focus on each part, feel it relaxing and releasing any stress or tension. Starting with the right hand. Bring your awareness to the whole right hand. The right hand thumb, first finger, second finger, third finger, fourth finger. Palm of the right hand, back of the right hand. Wrist, forearm, elbow, upper arm, right shoulder, armpit, chest, waist, right hip, groin, right thigh, knee, calf, ankle, heel, sole of the right foot, top of the right foot, right big toe, second toe, third toe, fourth toe, fifth toe. Bring your awareness to the left hand. Left hand thumb, first finger, second finger, third finger, fourth finger. Palm of the left hand, back of the left hand, wrist, forearm, elbow, upper arm, left shoulder, armpit, chest, waist, left hip, groin, left thigh, knee, calf, ankle, heel, sole of the left foot, top of the left foot, left big toe, second toe, third toe, fourth toe, fifth toe. Now bring your awareness to the crown of your head. Right side of the head, left side of the head. Right ear, left ear. Right cheek, left cheek. Right eyebrow, left eyebrow. Eyebrow center. Right eye, left eye. The nose, upper lip, lower lip, chin, jaw, throat. Right chest, left chest. Heart center. Right shoulder blade, left shoulder blade. Upper abdomen, navel, lower abdomen. Right buttock, left buttock. The entire spine from the tailbone to the base of the skull. Back of the neck, back of the head. Now bring your awareness to the whole right arm, the whole left arm, both arms together, the whole right leg, the whole left leg, both legs together, the entire torso, the face, the head, the body, the whole body together. Feel the whole body supported by the surface beneath you. Become aware of your natural breath. Notice where you feel it moving and flowing with ease. Feel the belly rise and fall with each breath. With each inhalation, feel the breath flow through the body. With each exhalation, feel yourself release all stress and tension. Feel the belly rise and fall with each breath. With each inhalation, feel the breath flow through the body. With each exhalation, feel yourself release stress and tension. Feel the belly rise and fall with each breath. With each inhalation, feel the breath flow through the body. With each exhalation, feel yourself release all stress and tension. Feel the belly rise and fall with each breath, welcoming a deep release. And continue to feel the whole body. Notice where you feel stress. What does stress feel like or look like? What feelings and emotions arise in those places? Observe where you experience these feelings and emotions and how they feel in your body. Are they a specific shape or color? Do they have texture, density, temperature? Now consider their opposite. Notice ease in the body. What does ease feel like or look like? Observe where you experience ease and how that feels. Is it a specific shape or color? Does it have texture or density or temperature? Observe where you experience these feelings and emotions and how they feel in your body. Notice now how you can hold space for both the spectrum of feelings and emotions associated with stress and ease without judgment or attachment. Now we'll practice being the witness without judgment or attachment. When I name the following images, envision them brightly in your mind and then release them as I quickly move on to the next one. A sunrise, a path through the woods, a rocky coastline, a field of wildflowers, a snow-capped mountain, a grove of evergreen trees, a campfire, birds in flight, rocks in the sand, clouds in the sky, lightning, ocean waves, a hammock, a full moon, a starry night. You resting peacefully in Yoga Nidra. Begin to welcome the presence of ease and steadfast joy in the body. Recall your sankalpa or intention and repeat it silently to yourself 3 times. Become aware of your breathing again. Feel the belly rise with each inhalation and fall with each exhalation. Releasing any residual stress or tension, connecting you deeply to your body in this moment. Notice the sounds around you. Visualize the space you are in. When you are ready, begin to move gently, stretching or wiggling fingers or toes, stretching overhead or rolling to one side if you're lying down. Take your time sitting up and slowly opening your eyes. This concludes the practice of Yoga Nidra. If you have a moment, reflect or journal on your experience and note any changes in your perception of stress in your body. And as you come back to the meeting, I'm happy to answer any questions about the practice, or you could drift away for the afternoon.
Yeah, thank you, Alyson. This is very profound practice. So if any of you guys here feeling a little tired, which I think could be, I definitely do so, but that's usually what happens with me when I have a chance of relaxing deeply. So if that happens, just let your body do what it does and maybe even take a quick short nap. But otherwise, if anybody has any questions, please let us know. Alyson, do you want to put a link to your practice somewhere?
Sure.
In case somebody wants to get in touch with you. And Janet, do you want to give us a brief intro for next week? March 21st. Oh, just beat me to it. All right.
So remind them of who Chris Palmer is.
So Chris Palmer, those of you who don't remember, he's the author of a recent book, Good Death, and you did hear it correctly. I was looking for the book. It was on my table somewhere. I believe Chris is coming back to do personal will with us. And am I right about this?
Yes, and so Chris will be taking the first 30 minutes. Misha will be holding his Q&A until 2:30.
Right, and then we'll do a brief practice, and we're probably going to do a practice based on Chris's work with us, something kind of continuing. So if you want to think about this a little bit ahead of time, if you already have 5 wishes or advanced directives or anything like this, do have it close by, because I think it would be useful for you as part of this exercise. Especially if you never did this before, I strongly recommend you do come and think about this. I think this would be a really good time to think about, how would we want to envision our last 6 months of life, and what's important for us to do and what's important not to do. It's going to be very practical, so it's not going to
If you have any family or friends who you think would benefit, please give them the registration link so they can register and join us. Once again, the first 30 minutes, because Chris has to go play tennis at 2:30.
And he is not giving that up for anybody. And I respect that wholeheartedly. Actually, I'm going to put link to Amazon to his book.
Okay.
If anybody wants to buy the book ahead of time. I don't think it's on, it's not on Audible, unfortunately. But it's gotten really, really good reviews. So I highly recommend it. The book is very practical, by the way. It's not kind of ephemeral conversation about the subject. It's very practical, like what to do, what not to do, how to talk to your family member about sort of what do you want in those last months and years of life. So I think it's